hit record.
Could you start on a call there?
Hi, yeah, welcome everybody to this webinar. We've got a lot of people on this webinar this afternoon. So the best way to deal with this is in a well-formatted manner is that you are all muted and you all have your videos off. You've all had the opportunity to submit questions through the Slido portal, so I hope you've managed to do that. But if you haven't, or you think of any additional questions as we go through, you'll also see at the bottom a Q&A option there. I can see we've already had 4 questions posted on there, which is wonderful. So I will make sure we get to those questions as well as we move through. It may be that they get answered as we go along. Couple of other bits. We also have the chat option there, and you have your raise hand option. So I might say, can you raise your hands just to let me know you can all hear me okay? So could any of you do that, please, just so I know that we're all okay and we're working all right? That'd be wonderful. Oh, yes. Fabulous. I've got lots of raised hands. That's wonderful. Thank you very much, everybody. Right, so I'll leave now to welcome Tim Cowsill, who is head of the business agency at the Department for Enterprise, and Dr. Henrietta Ewart, who is head director of public health. And thank you both for joining us. We really, really do value your time, and we're really grateful for you joining us today. And you know, we hope this webinar will give everybody attending the comfort that they need in the run-up to reopening, whether it be on the 1st of June or whenever they choose to reopen. So the way we're going to handle this is just go through all the questions that have been submitted. We feel that's the best way to address everybody's concerns. But as I say, please do add more questions or comment as we go along. So I'm just going to bring up the questions now. Where have I gone? Here we go. Okay, so lots of questions we've had are, this will be for Dr. Ewart, are in terms of whether it's okay to blow dry hair.
Yes, I mean, blow drying hair should not of itself be a risk activity, because you would not expect there to be transmissible virus in the water, the moisture on the hair that you're blow drying out. It's possible that somebody could transfer virus onto their hair. If they are an asymptomatic carrier, they could touch their face, touch their nose with their hand, their mouth with their hand, and then touch their hair. So in theory, the hair could be like any other surface that could have virus on it. But by the time you washed it with shampoo, and bearing in mind that soap will actually disrupt the surface of any virus anyway, you shouldn't have virus on the surface of the hair, and there is no way that it will turn into droplets in the way it is removed from the hair through blow drying. So blow drying itself would not be a risky activity.
Wonderful. Thank you, Dr. Ewart. That's wonderful. There were quite a few questions around blow drying, so hopefully that's alleviated that question. With regard, sort of sticking with the same theme, with regards to washing hair, should salons be asking clients to pre-wash their hair before they come into salon, or is it okay for their hair to be washed in the salon?
I think that's largely a matter of choice for clients and staff, really. I mean, anything that reduces interpersonal interaction contact will reduce the risk of transmission of virus. We are in the very, very fortunate position at the moment that new cases of virus are very, very low. I did make a note actually of when we last had a positive case. I'm just checking my notes.
5 days ago, isn't it?
Yeah, 5 days ago. So, you know, we cannot yet say that we categorically have no virus circulating in the community, but it's clearly at very, very low levels. Now, obviously, risk of transmitting virus depends really on 2 key things. One, are there infected people in the population who can go out and spread it unwittingly if they're asymptomatic? And two, are there susceptible people in the population who, if they encounter an infected person, are susceptible and will likely catch the virus from them. So the evidence on the one hand of that is that the levels in the community are now very, very low. So your chance of meeting an infected person are correspondingly low. Yes, we do still have susceptible people. There are a lot of us still in the population who will not have encountered the virus and therefore would be susceptible to it if we were in contact with somebody. So the risk is low. If you want to take extra action to make it lower, then that's where you might want to decide whether you want to say to your clients, you'll need to come in with your hair washed. But it would be difficult to say that that is what we would advise from a public health perspective, because the background risk from it would be low.
Wonderful, thank you very much. There appears there's little in the guidance regards to children attending hair appointments. Obviously, children often need to be accompanied or they sit on a parent's knee. Is this okay? Is it appropriate? And how does this work with PPE if masks sort of aren't suitable to fit a child?
Right. Children are at lower risk of having COVID than adults are. They seem to actually catch it much less, and they don't seem to spread it. Obviously, there's some equivocal evidence on that, but overall, it does not look as if children act as sort of spreaders of COVID. So that's quite reassuring in terms of offering service to a child. And yes, obviously, a child has to be accompanied by a responsible adult. And on occasion, you might need to have them sitting on the child, the parent's or carer's knee. I know a lot of places do things differently around that anyway. You know, the salons that have like special seats that are child friendly for children to sit in. And, you know, the old way of, you know, letting them sit on a pile of telephone directories. We don't have telephone directories these days, but, you know, booster cushion type thing are other alternatives. Again, it's down to the more interactions you have, the more there is a risk that you will encounter the virus. So if you can keep the parent or carer and the child separate during the kind of personal interaction while you're doing the haircut for the child, that's probably the best way to do it. Also, of course, we have to bear in mind the risk activities, and the risk comes from not only being in close proximity to somebody who is a potential carrier of the virus, but it's how long you're in that close proximity and the nature of it. So if it's less than 15 minutes for a quick haircut and you're not face to face for most of that time, but only a small portion of it, you're still back into low risk.
That's perfect. Thank you, Dr. Ewart, because actually then one of the next questions was, you know, if the treatment's less than 15 minutes, like a child's haircut or even some haircuts for men, you know, can be very quick, and it's less than 15 minutes, you know, can they do it without a mask? Or, you know, would you still recommend the mask? But obviously, you know, as you say, that the level of transmission is very minimal.
Yeah, I mean, the masks, we are not making categorical statements that they should be required, because we really don't think the evidence justifies that. The evidence is not very much of it, and what there is pretty weak, but what there is suggests that by wearing a mask, you can potentially reduce transmission by the mask wearer. You don't protect yourself by wearing a mask, you protect others. So again, if you've got symptoms, the way to do that is by staying at home and not going anywhere. You know, you really shouldn't be relying on a mask to do that for you. But if you're asymptomatic and you're concerned that you could possibly be an unwitting carrier, then by wearing a mask, you will reduce any risk that you will spread it to other people. You don't reduce it to zero, but you reduce it. So when is a mask useful? If you're out in the open air, 2 meters away from everybody and only having brief passing contact, then really it's not an issue. Where you would maybe want to think about a mask, it's when you're in a very busy situation or a very close contact situation, so busy supermarket, on public transport. So if you extrapolate that to the situation within a hairdresser or beauty salon, you will be within, when you're doing a personal hairdressing or beauty service for somebody, you will be obviously less than 2 meters. Again, how long will you be face to face? Because if you're working at the back or sides, the risk is lower. And again, how long is it going to be for? So a mask isn't a kind of thing that you must definitely have, and it's not a magic solution to things. It's just part of the response you could have as part of your overall risk assessment.
Wonderful, thank you. For mobile visits, it's been suggested that there's an extensive checklist that should be sent to clients prior to the visit. I don't expect you to know all the ins and outs of that currently, but do you know if there'll be clarification on this checklist, whether there'll be a checklist circulated?
So
I think maybe that's one for Tim.
Yeah. So is that in terms of mobile hairdressers? You're asking?
Yes. Yeah.
So there is already guidance and a checklist. It's under construction, but actually the same process of entering someone's house, whether you're a trade or anything, is pretty much the same sort of things. People have got to feel confident to make sure that somebody isn't over their shoulder when they need to be and having the space to do their work and it's clean. We have got some extra guidance that will be going up in the next couple of days that Environmental Health have given us. So that will be attached and we will do that. But for the moment, if you're wanting to see the sort of guidelines that we're looking at in terms of risk assessment, have a look at the Construction Federation page, and the guidance is linked on the COVID site. But use that as a trade entering a building. It's the same premise. You've got to make sure that the procedures are in place. Yeah.
My colleague Jessica Kitchen is on this this webinar, so I'll ask Jessica to pop the link to the construction guidelines in the chat so people can pick it up from there.
But hopefully next couple of days we'll get that. They've sent it today, so it'll just
excellent.
Be
excellent, thank you. So, okay. Do we need to change masks after every client, even if it's the material masks?
The guidance on masks is change them when they're moist.
Right, great. Quick and easy. There's another one about the checklist for mobile, so we've said that's on its way. Now, I've had a few questions regarding facials. Are they, it says they're not allowed. Do you know when that's likely to change, or is that something you can't really determine at the moment?
I think with releasing the restrictions that were put on in phase 1, there is something about doing it in a managed way rather than taking everything off at once. The reason I say that is because when countries around the world, ourselves included, went into the first phase of trying to suppress the virus, we all introduced a range of measures as a package. Now, that's definitely worked, and you've only got to look at the Isle of Man curve on the website to see actually quite how dramatically it worked. But the other side of that is that we do not know with any surety which different elements of all those different packages really had the effect. So there may be some things that we did in that package which actually we maybe didn't need to have done because they won't have made that much difference. Whereas others may turn out to have been the absolute key ones. And we really don't know, neither us here nor anywhere across the world knows, because that was the way everybody went, because it was what needed to be done at the time. So that means in terms of taking the restrictions off, we're trying to go as far as we feel we safely can, but then coming to a point where we say we'll go this far, then we'll review it in another 2 weeks, and 2 weeks is the standard time for review because that covers off the incubation period for COVID. So if you leave something for 2 weeks, that gives you time to see, is that curve taking off again? And we will see that very quickly if it does.
Thank you very much, thank you. One for you, Tim. If staff choose, if staff choose not to go back to work due to the personal risk of coronavirus, will they still be covered by the salary support scheme or the mirror benefit until it's completely safe to return to work?
Yeah, absolutely. You will find that you will have individuals that can't work because of a number of reasons, childcare, or if they've got vulnerable or extra vulnerable in their household, etc. You as business owners are the best ones to understand who you know your staff the best. So the idea is that you make the decision. The salary support scheme will still be paid to you. We're not looking to change that. What we will be doing is looking at how the impact of opening up is. Obviously, your industry cannot fully open at the moment because we've restricted in the number of treatments and things like that you can do. So this is a journey. We need to continue to talk to you and update you and see what the impact to business is. I'm really interested to see that there's been quite a lot of, I've spoken to a number of salons and things that have had a number of inquiries for people wanting to, desperate to get their hair cut, and it's probably me included in that. There's a lot of product holding this down at the moment. But the idea is that we can bring back businesses, we can support businesses through this in the medium term, and the Treasury Minister has made that announcement. But we have to keep updating, and we have to know what's going on in your businesses to be able to bring that to the face of the politicians, so they know what's going on.
Thank you very much, Tim. One for you, Dr. Ewart. With regard to contact tracing, if a client is found to be tested positive for COVID and a salon is on the contact tracing list, would all the stylists and clients that were in that day need to self-isolate for 14 days and potentially shut down the business?
No, they wouldn't. The people who are advised to self-isolate are people who are identified as close contacts. So, as a general summary of a close contact, it is somebody who spent more than 15 minutes in less than 2 meter distance and face-to-face. So that would not usually take out more than a proportion of people who encountered them in the salon, so it shouldn't lead to closures.
That's great to hear, very good to hear. I'm sure that gives a lot of comfort to people. I've had quite a few questions around facial waxing, obviously lip area, close to the mouth. Is this allowed with the clients having to remove a mask? How is this okay?
I think it's got to be high risk because I think, it is an activity that could potentially generate aerosol transfer. Somebody may be mouth breathing, they may try and talk to you while you're doing the waxing, and if the waxing's painful, they may articulate that, and in doing so again generate droplets. So obviously, as we've said, if nobody's carrying virus, then that doesn't matter, but we cannot rule out the fact that we still have low levels in the community and possibly asymptomatic. So we couldn't categorically say that that would be a low risk activity. It would definitely be one of the higher risk ones.
Yeah, so really it's up to the salon whether they choose to do the higher risk procedures or not.
I think we're trying to move to a position where we're giving, evidence, guidance and advice rather than trying to regulate through an enforcement approach. But yes, there are definitely things that people would need to take into consideration before they decided whether that was an activity that was appropriate to do just yet.
Wonderful, thank you. I'm just having a look at some questions that have been posted now while we've been on the chat. I'll just bring this up. One for you, Tim. Is the government providing another lump sum grant to help business owners? I assume it's similar to the 3K grant. Yeah. Pay rents, etc., whilst earning capacity is reduced. So what they're saying is the 200 mirror or the 280 doesn't cover rent or product, utilities. So is there anything else that government are planning in terms of grants while the businesses are sort of in the process of picking up again?
So we're in a data collection point of view. We've just opened some sectors up, so we're now seeing, you know, non-essential retail being one that came back, and is probably in a similar vein to you guys that are just about opening up. We need to understand what opening up means, what the demand is like, what the situation is. I think across the business agency and the Department for Enterprise, we're really keen to stimulate demand rather than doing anything else. So we'll be looking at a series of measures to make sure that the demand is there from the economy, because the government can't sustain the amounts that it's giving out. It's not something that's a long-term solution. So we've got to be able to support our economy, and the only way that's been talked about is through stimulating demand. But doesn't mean to say that we haven't. We've the Treasury and Department for Enterprise are looking through. We've got external auditors having a look at the island's economy. We are understanding what the health of it is, so that we can produce the right support. You know, the £3,000 for a lot of businesses wasn't the right amount to support them anyway. You know, that wasn't a long-term solution. It was an initial reaction. We're now in a place where we're taking that breath and seeing what the state of the economy and what the long-term solution is. Making sure that businesses can operate in the right areas, and it supports Henrietta's view in that, you know, we're trying to give as much space to businesses to do the right thing. We don't want to enforce, we don't want to cause things, but we're leaving it up to the businesses to control their own staff, to control, you know, what procedures they're doing to make sure that they feel safe and their staff feel safe. All I would say is that, you know, essential retail has gone through a lot over the last couple of months. It started off very closed, people were wearing masks and gloves, and you can now go into it, you can see that well-oiled machine has come through it, and the people have got used to a certain way of living, and that's kind of what we're trying to do by bringing back the sectors on a phased approach. And with that, so will the support. But we will look at it, and it's just about us collecting data and making sure that we're giving the right support, not just putting a one-size-fits-all on an economy that's very varied.
So thank you very much, Tim. An interesting one here for Dr. Ewart with regards to contract tracing. There's a couple here actually. One around, do we need to keep records for tracing purposes in case the virus peaks again? And how long do we need to keep customer details for contract tracing? What other must-have personal details we need to record or have to hand? I don't know whether, Tim, there's guidance out on the contract tracing. Is there something in the guidance?
I think most businesses will have this. They know their customers. So I guess the only thing that they perhaps need to, you know, if somebody's putting an appointment in, you've got their name and telephone number. You kind of know when they're in what date they're in. So they don't think there should be too much extra collection that you need. You just need to make sure your records are up to date. And a lot of businesses have implemented digital and websites and all sorts of stuff, which will hopefully make that a lot easier. And that's all about just getting into a new routine, but we don't expect to collate everything. You don't need your hair records on file. That's absolutely fine.
So it's just a case of, just in case it's for tracing purposes only. Government aren't going to be asking for continual lists of everybody that's been into hair salons. It's purely in case there's a case that comes up and that individual says, oh, well, I went to this hair salon 3 days ago, you know, so they can just keep a track on everything. Great, wonderful. Exactly. Thank you. Okay, that's right. Can the virus live in polish, nail polish, gel polish, or acrylic?
To the best of my knowledge, no studies on exactly that have ever been done. But studies that have been done around virus survival in food suggests that that's not an issue. We know that the virus can survive on surfaces where it generally survives for about 72 hours. So the risk areas, rather than the actual polish itself, would be around, you know, the outside of the bottle, the lid, all those touch points. So again, this is down to the way to mitigate that is just by frequently wiping over with sanitizer. Yeah,
absolutely. Thank you. Somebody asks if they contract the virus and the trace is done back to their salon, are they liable to be taken to court for not maintaining suitable standard of hygiene at their place of business by the families of the infected, especially if somebody unfortunately passes away from it?
I'm not an expert in that area of the law, but I think, if somebody did want to mount such a case, they would have to be able to document the failings. So it's back to, be scrupulous in what you're doing, risk assess it, record what you've done and why you've decided to do what you're doing, and then show that you're doing it. That would be the way to mitigate against any risk of that.
Thank you. One possibly for you, Tim. A few questions about insurance. So obviously, businesses have been told to comply with government guidelines on social distancing, which is 2 meters, which they will be breaking to perform treatments. So how does that work with their insurance?
So we produce separate government guidelines for this sector. So I would refer the insurance companies directly to that guidance, which explains what we've laid out in that. So rather than just the general government guidance in terms of stay safe, it's outside of that, specific to this particular sector. So I would push them towards that. And I did see something about it being a draft as well. It will be draft until the day comes on the 1st of June. We will update it to be fully then, but it's draft at the moment because we're still listening and seeing what works, what hasn't worked. But I've had quite positive responses on the draft, so I don't see it changing that much in the next couple of weeks. But it will become, when it becomes in law, that sector, because the thing is, it's in law at the moment that you can't open.
Yeah, great, thank you. A couple of questions in one, because they're small, short questions. Can retail products still be on display in the salons? And can each stylist have more than one client in at any one time?
I'll go for the retail products. So no testers, things like that. Shouldn't be using those. You can have them on display. That's no problem at all. And actually, hairdressers and barbers are allowed to sell products at the moment under the non-essential guidelines. So if you've got products to sell, you can sell them at the moment. There's nothing wrong with people going in to buy that. The next one's probably for Dr. Ewart.
Right. Where possible, have your bookings sequential, so you've got one client coming in and they're out and then the next one comes in, because what you're trying to do is reduce interactions between people. If that's not possible, then if you can have a socially distanced waiting area and you can manage the way people move into and out of it so that people aren't crisscrossing, then you can do it that way. But the optimal would be to run your booking system so that it's one in and they're out before the next one comes in.
Great. And somebody else, sort of similar sort of question. So if there are 2 staff in the salon and there's lots of space in the salon, it's a large salon, can they put a colour on one client and then go over and work on the other client while the colour's setting, so they're sort of working between 2 clients at the same time? Is that possible?
Yes, I can't see any reason why that wouldn't be possible.
Great, excellent. One for you, Tim. Anybody that's currently claiming Mira, when they go back to the salon, how long do they have to cancel their Mira? Will it continue? How long can they keep it going for? Do they have to cancel? Will it automatically stop?
So my understanding is it's done on a payroll basis. So if you're in the middle of the month, you put the date that you want to start, but support is in place during that time. So it just depends. You depend on an individual business. Have a look at what your bookings are, your appointments are, and work out, actually, I think I'll be okay cash flow wise. I'll understand it, but the support is there to run alongside, not to run separately.
Thank you. Is it okay to use a hood dryer? So I assume that's one of the sort of big dryers that goes over to set hair. Do you think they'd be okay, Dr. Ewart?
Yes, I mean, again, you've got all the issues of it being a potential surface, and that could include the inside as well if that's making contact with the client. So it would be very much around, the sanitising and the extent to which that's possible.
Excellent. What's the situation with air conditioning in a treatment room while carrying out a massage?
Yeah, I mean, air conditioning is fine. Basically, what you want to do is have a space that is as well ventilated as possible. Now, air conditioning systems, and I'm not a heating and ventilation engineer at all, but my understanding from reading is that there is a lot of variation in the way you can set air conditioning systems, and that some of the most economical settings involve actually recirculating the same air. And that is not good, because that could potentially concentrate any virus particles that you happen to end up with in your system. So you might need to discuss with the people who service your system what sort of setting it is on, and make sure, if you need to have it, that it's on an optimal setting for freshening and replenishing fresh air through the system, rather than recirculating the used air.
Excellent, thank you very much. A couple of questions around mobile hairdressers. If a mobile hairdresser enters a home, do they have to change their PPE if they're working on two members from the same household? Do they need to wear shoe covers? And are they expected to wear disposable aprons?
The PPE requirements are really what you'd use anyway. So if you're doing a colour, I imagine you're going to be using gloves and probably an apron as well. Masks we've already talked about, that we're not making hard and fast statements about you must wear them in these circumstances. Gloves, the most important is to protect the wearer from the chemicals in the product that you might be using. Gloves as PPE, actually, we don't really support, because you don't catch virus through your skin. You catch virus by getting it on your hands and then touching your face, particularly close to your mouth, nose, or eyes. So gloves don't really protect, they just add an extra surface. Instead of your skin having the virus on it, it's the gloves. So if you're still touching your face with gloves, you've actually done nothing to reduce the risks. So I think, back to the advice that it would be the equipment that you would use for that treatment, and you don't need to be doing it differently because of the virus.
Thank you. I have two individuals who are actually pregnant currently, and obviously classed as high risk. Could you advise whether they can go back to work, or they best to continue to social distance?
It really needs to be down to their decision, because it is perfectly possible to go back to work safely if you are in one of the vulnerable groups. So that's the older people, the people who are eligible for an NHS flu jab, and pregnant women. It's about what you can put in place in your workplace to mitigate your risk. Again, we come back to the fact that we've got very low levels of virus circulating at the moment. We monitor that literally day by day. So if the level goes up, we can announce that, people will see that, and people may change their risk assessment on the basis of it. So you may feel confident going back if you're pregnant now, or if you're diabetic now, but if the pattern changes and we start seeing more infections, then you might want to reassess that.
Thank you very much. Is there any guidance for the management and disposal of PPD or PPE or disposable products which may carry transmission risk?
Yes, that's included in the guidance for the general trades and businesses. So this would apply to this as well. And it's basically bag it, quarantine it for 72 hours, and then put it in the general disposal.
Great, thank you. Just reading through these now to make sure we're covering everything. If you can't use air conditioning on the recirculating air conditioning setting, which you mentioned, how are they still okay to use hairdressers, which obviously, recirculate the air, hair dryers?
Yes, I mean, that's on a much smaller scale. And so long as you've got good ventilation, have windows open, then that should be fine.
Excellent, thank you. That one's been answered. Somebody's mentioned that they've read in other countries there is no dry cuts allowed, and no cuts around the face, but I think we've clarified that that's okay here.
Yeah, we talked about that in some of the workshops, and it was decided that it wouldn't simply work, and actually mitigating it through either wearing a mask or doing it quickly, or keeping it under the 5 minutes is a good way to mitigate that.
Excellent. What about furnishings like cushions and blankets on treatment beds? Do they all need to be completely removed?
Yes, I mean, in general, the general rule would be to use only the textiles that you can use once, so like towels, sheet, whatever you would have for your treatment in that way. The sort of soft furnishings that would generally be there as part of the ambience and that you wouldn't change between clients, so, you know, your blankets, throws, cushions, that kind of thing, remove them as far as possible, because they basically represent a surface that could be contaminated with virus and which you can't really wipe down with sanitizer. So unless you're going to be washing it between clients, you know, take it out.
Yeah. Great. Somebody's asked an interesting question here, that there's been a lot of talk of sneeze screens being virus collectors, with the virus sticking on nail dust, and then the dust sticking on the screen. And they just wanted your opinion on that.
Yes, I mean, any surface can be contaminated. So a screen that is not being cleaned and is just, you know, being sneezed on and building up potential loads of virus is bad news, particularly if people then touch it and then touch their faces. So the screen, along with any surface, needs to be regularly sanitized. And if you're using it, for example, in a nail bar as the thing that is between the client and the nail stylist, then it needs sanitizing after each client, basically.
Thank you very much. Somebody's just mentioned on the live Q&A, can we still offer our clients tea and coffee?
We recommend against that.
Okay, thank you. I think you answered this one. With regards to the mobile hairdressers, they can do the whole household, that's okay, all at the same time, is that correct?
Yes, because the household obviously is the household.
Yeah, great.
That wouldn't extend to inviting in your friends and neighbours. But
yeah, great. Somebody's just popped on the chat. What's your opinion about, well, we've spoken about lips. Well, we've spoken about waxing, facial waxing. What about lips, eyeliner and eyebrow tattooing?
Your eyeliner and your eyebrow tattooing, you can probably mitigate by the client wearing a mask, and indeed by how you position yourself potentially. I'm not an expert in how those particular treatments would be done, but again, if you can mitigate so that you're not directly face to face, if that's possible, that would be a thing to do. And in that situation, obviously the client could wear a mask.
Yeah. Great, thank you. Another Q&A that's just come through live is, when massaging, can the towels just be protected with couch roll or plastic sheeting, or should the towels just be washed after each treatment?
I think washed after each treatment would be what you're aiming for.
Excellent, thank you. Somebody's just added to the comment regarding mobile hairdressers going into households. If you're only allowed 15-minute contact, how could you have the time to cut everyone's hair in the one family?
Have we said 15-minute contact? I'm not sure quite where that's come from.
No,
Tim?
I think that comes from the fact that we've said to try and keep limited face-to-face interactions down to 15 minutes. Doesn't mean necessarily that you have to do the hair in that, as I've heard that it can take a little longer than that.
Yeah.
Yeah. Men's beards, are they trims not advisable? Again, I think that goes back to discretion of the salon. Can you hear me okay?
Yeah, we had that feedback. Yeah. I think that comes back to the feedback we had from a couple of businesses saying that they just couldn't implement the trim that they would need to in the 15 minutes, so they'll remove it for the time being, but then there may be other businesses that could do it. So we just kind of left it open so businesses can make their own decision based on each beard. No beard is the same, I believe.
Somebody's just added now that, thinking about those salons that are delaying their opening until later than the 1st of June, if the cases continue to drop as they are now, do you think that the need for PPE will be reduced? You know, obviously these are salons that are thinking about, you know, buying and spending money on lots of PPE now, finding it might be redundant by the time they open later than next week.
Yes, I mean that is always a possibility, and actually one would hope that that would be the outcome. It might hurt people in their pockets if they bought it, but you know, for the population as a whole, that would be a good outcome, and that is the outcome we hope we're working towards. As I said, the lower the level of circulating virus is, the less you need to mitigate, because if there is no infection, then people can't catch it. But we're too early days to know which way the trend line will go, really.
Yeah, I guess just don't buy tons of the stuff, I think is the
Yeah.
we don't want businesses spending too much on this for things to change, and everything is up for review. You can see countries changing that on a day-by-day basis, so it's difficult. We want to stay positive, but equally you'll get a cheaper rate for the more PPE you buy. But again, we may remove it, but you may feel the need, or your staff may feel the need to keep it in place. That's you know, that's something that we've seen across the board, that individual staff members have said, no, I'm not doing it without it, and that's absolutely fine. We as guidance, and it's the same with opening on the 1st, you know, we're allowing you to, doesn't necessarily mean you have to. No one's been forced, or the 15th or any of those dates. It's just that the economy can open for that part, and you've got the guidance to open and conduct it safely.
Excellent, thank you. Somebody's asking if you would mind elaborating on the risk of Legionnaires. Will water systems be tested? Should high-risk people avoid using water? And should PPE be worn 24/7 with this as a potential risk?
Right, now the potential risk on this one comes from the fact that people's businesses have been in limbo. They've been inactive for a number of weeks now. And within those inactive businesses, people haven't been going in, turning on taps, basically doing the natural wash through of water systems that just happens because we use the water systems. So that's why we've got this potential raised risk. And the risk is in warm or hot water systems, because Legionella likes warm water tanks that are stagnant. So if you've had a body of warm water that hasn't been being flushed through, refilled, reheated, drained, refilled, reheated, etc., there is a potential risk that Legionella will have colonized it. Now, the way to mitigate that is to follow the instructions, which will be going, if they're not, they may not already be there. I think they're definitely in the draft guidance that Tim just referred to. It's very clear guidance by the Chartered Institute of Environmental Health, which tell you step by step what to do when you restart your water system when it hasn't had the taps turned on for a period of weeks. And it's not difficult. You don't need to bring in, you know, water engineers or anything. You can follow those very clear instructions, and that will mitigate the risk for you. And again, you know, if you want to make sure that you've recorded that in your records, then that kind of protects you from any future litigation.
Wonderful, thank you very much. Sorry, Dr. Ewart, we're making you work hard this afternoon. A couple more, still a few bits of hesitation around massage therapy. Because the states on the government website that massage parlours should remain closed, but the draft guidelines does mention massage.
Actually, you're breaking up.
Yep, we can't hear.
I'll try again. Can you hear me okay now? Can you hear me okay?
Yeah, that's good.
Wonderful.
Yes.
Probably my children going on some sort of streaming device. Yes, it's just the restrictions around massage therapy. I think there's a little bit of confusion because massage parlours remain closed, but of course a lot of salons and beauty parlours do offer massage. Is this okay? And are face and head massage okay?
I think the general response to that would be yes, it is. I mean, we've also looked at opening up again some of the allied health professions that would use massage, so physiotherapy, osteopathy, chiropractic, that kind of thing, where massage, musculoskeletal massage, might be part of a therapy. So there's no reason why that would be restricted of itself for any reason. Again, it's about doing the risk assessment. If you're doing head massage, I imagine you can do that without getting really face-to-face contact. You're actually able to be quite a distance away. And again, you can look at the client using a mask, and the staff ditto, to reduce that risk even further.
Wonderful, thank you very much. Just going through the live Q&A. Should salon toilet facilities be open or closed?
I think it's a good idea to have them open because they offer an opportunity for people to wash hands, and washing hands and having sanitizer available is a good thing. Toilet facilities, so long as you can maintain usual hygiene and avoid queues, people coming in and out at the same time so that they're, in close proximity in a confined space, that kind of thing. So if that's possible, and bearing in mind that we've said in an ideal, the optimal is to have one client in, that client out and the next one in, if you're able to work with that sort of system, the pressure on toilet and washing facilities should be low, so you should be able to manage it safely.
Wonderful. One for you, Tim. Somebody says if they just do small amounts of work and earn a minimum amount, will their salary from the government continue, as they don't want to lose all their customers? They want to do a minimal amount of work, but not enough to earn enough. So will they still be able to receive their MIRA from the government?
So they will still be impacted by COVID-19, which is the big important bit. So they'll absolutely still be able to have that support for the medium term. It's the same with everyone. The fact is that you've got to clean down areas, wash things. You won't be able to go through the clients that you usually would. We understand that. We put procedures in place to potentially slow that work down. And as we slow down work, you earn less money. We completely understand that. So that's the precedent for everything, really, is that we know that this is a phase and the support's there to cover the medium term, but understanding it doesn't cover everything. But this is kind of where we want to get the demand and the health risks balanced. And this is the way we do it.
Excellent, thank you. Just back to massage quickly. Do people need to wear gloves to do a body massage?
No, it's back to gloves really giving you a false security. It's hand washing that's the important action there.
Yeah, wonderful. Tim, just quickly, back to your point, do people have to submit to government what they're earning at the salon to continue to claim?
So it depends on the scheme, but it does ask about what sort of turnover and things are going through, and that against the previous year. That's the word I was trying to say. So it will explain that, and you should absolutely include that in your application. It doesn't actually mean that you won't get the funds, but you are still being impacted, and it's showing that impact, which is the important bit. Great.
And I'm sure the answer is yes to this, but will there be more guidelines as time goes by, things get better or worse, whatever way, will you continue to push out guidelines accordingly?
Yes.
Yeah. We need to tidy up our guidelines as well. As we brought on new sectors, certain bits are on certain parts of the website, so we are looking to do an overall sort of general principle for doing business for guidelines, but we will adapt and change, absolutely.
Excellent. All right, I'm just making sure we haven't missed anything. Do we need to reapply for the next 3 months to get MIRA, or does it just continue?
So I think you have to do an application process for the salary support scheme. I think MIRA is the same, but just the usual process will continue.
Okay, great. Right. Just checking I've still got a few questions knocking about, just to make sure that we've covered everything. Okay, that's fine. So a couple of people have asked about a limit to how many people they could have in their room of a certain size. I'm assuming currently, as long as people can maintain whatever they can maintain for the 2 metre distance within the space they've got.
Yeah.
Yes.
I think it's important to make sure that you've got enough in the waiting area and that your staff are keeping 2 metres distance and your your customers. So it's balancing all that and making it. We haven't set a set amount per square foot or anything like that, because each business is very, very different, and some might have areas to wait outside, some might not. So we couldn't bring it down to that sort of level.
Yeah. Somebody's just put on the chat, can gloves be worn for shampoo? But obviously Henrietta has explained that gloves, you know, don't mitigate that risk. What about pedicures and manicures? Are they okay?
Yes, I mean, again, pedicure, particularly because you're a long way from the face in that situation. The manicures we've really touched on already when we were talking about like the nail bar and whether you would want a perspex screen, because that is more akin to face.
Tim, one for you on the mirror. Oh, it's just disappeared. Where's it gone? It's disappeared. The mirror mentions that you must declare if you earn over £50. Mm-hmm. Does this mean if we earn over 50, we do not receive any further help?
No, that's not the case. It's just to see that the business is active. So
right.
It's done on a case-by-case basis. There are all sorts of stuff with mirror, as probably most of the businesses understand. You have to be up to date with tax and all sorts of bits and bobs. There's a lot of separate areas to that. But it doesn't necessarily mean because you're earning you stop, but they may ask for more information and develop it from there. But that's absolutely just to confirm the active side of it.
Excellent. Another one for you, Tim. Are salons allowed to put social distancing markers on on the pavement outside their premises?
Yeah. Don't paint them on, or the commissioners might come and get me. But a lot of the commissioners have offered tape and things like that, which is absolutely the best way to go, and does show it quite easily. Obviously, you're limited to the frontage of your particular premises, so you can't just start putting a queue outside the next guy because it doesn't look too busy. Work with businesses to work out what's best. If there is a business closed, get hold of the owner next to you and say, you're closed, can I use a bit of space for my queuing system? Especially if you decide that you want some parents to wait outside if it gets all a bit thing. I guess one of my key bits that I've noticed from working the business is you will quickly realise what doesn't feel comfortable when you start working. You may set a number in your head about how many people can be outside, how many people can be queuing, but you'll find that your staff and yourself and your customers will feel uncomfortable the moment that you sort of engage into anything tighter. So just be flexible on it and put in your best system. Some people have suggested to put a number system down because they've got a door in the middle of their particular premises, so like a 1, 2, and 3, or appointment 3, or whatever it is. Lots of businesses have tried lots of different things. So have a look at the non-essential retail guidance as well, because that will help you understand the queue management and what can be done on that particular one.
Yeah, wonderful. Thank you. Dr. Ewart, a couple of people asking how long really maximum people can spend face-to-face with a client, as many of them can be in the salon for 2-3 hours. Is this okay, or should you try and limit it as much as possible and split out treatments?
I'm imagining that it would be very unusual to have a 2 or 3 hour run of treatment that required you to be, up close and personal, face-to-face for the entire period. It comes back to, doing the overall risk assessment. If there's low levels of virus in the community, your risk from any activity is correspondingly low. Being directly in somebody's face is obviously high risk. If you're both wearing masks and neither of you are speaking, that lowers it a bit. So that's something else to think about, that, don't talk to your client or let the client talk to you while you are working in a face-to-face arrangement, and keep that face-to-face working down to the absolute minimum.
Excellent, thank you. One salon says their hand washing facilities are at the back of the salon, which means the client would walk through the salon to the bathroom, obviously touching handles, etc. Is hand sanitizer sufficient to mitigate that risk?
Yes, the only circumstance in which hand sanitizer is not as effective as soap and water is if there is visible dirt on the hands. So, if somebody's a farm worker and they've been doing something, on the farm and are covered in whatever type of muck, then putting sanitizer on top of that is a waste of time. But I would imagine that clients coming into a salon would not usually be in that category. So sanitizer should be an acceptable alternative to save them having to walk right the way through.
Wonderful, thank you. Another question on the guidance, Tim. Do the salons need to let their client know that their personal details may be shared with government or public health?
Yeah, that's absolutely fine. I think people will get used to this, and it'll be the same for any appointment-based service. That will absolutely be the case. But we just keep the information to a minimum. A name and telephone number and time in is the kind of just basic thing that we need to be able to do that. But that individual will give the contact of your salon to start with, and then they will contact through that system. So it should be fine.
Yeah, wonderful. Now I'm just very conscious of time, and we will need to cut this at 2 o'clock, 3 o'clock. I still have some questions here, but I'm hoping that we've managed to answer the majority of people's questions. So I'm just going to finish off with the last couple. There's two that are sort of related for you, Tim, is what support is in place if again, it goes back to either if the owner contracts corona, or they have a sort of an outbreak amongst their employees and they have to close the business down. Will they be able to get some more financial support to keep them going, even though that sector is technically reopened?
So the sector has still got support, whether it's open or not. If an individual case breaks out, like we spoke about earlier, that it doesn't necessarily mean the whole business has to close. And we will obviously support a business through that contact tracing. We'll be there, and we won't actual added support. The answer is no at the moment, but that doesn't mean it isn't in the case. But we haven't had a situation like that yet. Hopefully not. That's probably one major thing that we're currently with at the moment. So it's about us adapting and changing. But we will be out there and we'll help businesses know what a deep clean is and all that sort of stuff. That's
great. And just to finish off, just to clarify, Tim, did you mention that a list of treatments which are and are not allowed, is that going to be published?
So there isn't a list of treatments, but it's around that 15 minutes face-to-face, which is the big thing. If you have to do something that takes more than 15 minutes to face-to-face, so an extreme beard, for example, then that would be something that wouldn't do. We've left it open so that businesses can make a decision, because some practices will mean that somebody could have something done to their face, but you actually only need to pop back once or twice just to remove or take something off, like a wet shave, for example. That whole process takes longer than 15 minutes. But it's included in certain parts of it. So we've tried to leave it open for businesses to make the right decisions based on their staff and their situation. It's very difficult for us to cover every single individual treatment. As I have learned through this last 2 weeks, the beauty processes are vast, extreme, and so it is absolutely something that we can't fit for every purpose. But if you have the 15 minutes face-to-face thing in your head when you're looking at all your stuff, then do it that. And you can always do a phased approach in that you bring certain things on as you realise that actually, I could probably do that particular thing. And that's why we don't want to lock you down into one area, because that flexibility's got to be there.
Yeah, excellent. Thank you, Tim. And did you say that the checklist that salons can use to their clients, is that out yet, or is it being released?
It's being released. I think we just got it. I got it this morning from Environmental.
Excellent. Okay, wonderful. So that will be coming soon then. Yeah. Just want to pop up a quick poll for everybody. I'm just intrigued while I have everybody here as to who is actually planning on reopening on the 1st. And while everybody's polling that, I'd just like to say thank you very, very much to you, Tim, and Dr. Ewart, for your time. We really, really appreciate it. This webinar has been recorded, so people can go back and listen to the answers again they may find useful. I am aware that we probably haven't got to every single question. I think we'd be here until 10 o'clock tonight, because everyone has so many questions, but I hope we've covered off sort of a very wide-ranging areas of questions. I will leave the chamber question portal open. So if your question wasn't answered during this webinar, please pop it on there and we will endeavour to get that answered for you. separately. So thank you very much. Just looking at the poll, I'm not sure if people can see the results or not. We have 31% saying yes, they plan to reopen on the 1st, 53% saying no, and 17% still unsure. So it's fairly split still at the moment. So excellent.
So just want to sort of wrap up just a couple of bits. So we will produce some more detailed question and answers from Chamber. So we will publish something that will answer a couple more questions. On the 1st of June, and whenever people are opening, myself and my officers will be going around the streets and different places to check in with businesses. So don't feel like you're left. This is your only opportunity to talk to us, because we will be out and about and we will come and speak to you. We've done it for non-essential retail, we'll do it again. So hopefully that will give a bit of support. But if you have any direct questions, we're happy to answer them through the Chamber, because it's such a useful one, because it gives us time to be able to produce the right guidance and support that's needed. But we will continue to work with you and understand the impact. So that's from me.
Wonderful. Thank you very much both, and thank you all for attending.
Thank you.
Thank
Bye-bye.
you.